The purpose of this analysis is to compare the rates of patients who reported that they were given information about what to do during the recovery at home, given the rates of readmission and mortality for acute myocardial infarction, coronary artery bypass grafting, chronic obstructive pulmonary disease, stroke, heart failure, pneumonia, and hip knee replacement at multiple levels, including state, county, and hospital type. For the data visualization, it is recommended that you enter full screen mode by clicking the icon in the lower right corner. The upper left table of this dashboard shows two health outcomes and the average across the geographic areas selected. This scenario requires you to filter the data by a health outcome measure. The upper right table shows the average of the selected health outcome by hospital type, as well as the average percentage of doctors that reported to always communicate well. The same is broken down by state in the lower left table. The scatter plot shows the relationship between the health outcome rate and the average percentage of doctors that always communicate well for each state. Using this dashboard, we can filter data to a selected health outcome measure, such as heart failure 30-day readmission rates. We can see that there is a negative association between heart failure 30-day readmissions and the percentage of doctors that communicate well. This means that as the readmission rate increases, there is an observed decrease in the percentage of patients that reported their doctors communicated well. We can further sort the data to see which states have the highest readmission rate. In the lower left table, select the sort icon near the average health outcome rate to sort in descending order. You'll see that DC has the highest rate, followed by Puerto Rico. Near the top is New York. If we filter the data to just New York, you'll see that the readmission rate is highest in acute care hospitals compared to critical access hospitals, and that this corresponds to a lower percentage of patients reporting doctors communicate well in acute care hospitals. The use of this dashboard can reveal trends in specific health outcome measures related to patient satisfaction that may indicate differences by hospital characteristics, such as the type of hospital or its location.